Hi, I'm Nate, and welcome to the channel. One of the experiences which led to where I am now was my Obs and Gynae medical student placement. Prior to my rotation, I'd never even considered it as an option. I thought perhaps I'd go into pediatrics, cardiology, or even anesthetics. But I had such an interesting and confusing time during my obstetrics rotation, I had no other choice but to continue exploring this specialty. And it's still mind-bogglingly confusing. Another thing that is mind-boggling is if you're not subscribed to the channel. It's easy to do. Just click that subscribe button and of course, give this video a like. And if you haven't watched the companion video, the link is up here and in the description. But stay tuned to the end for my bonus tips. What I enjoyed about this specialty was how perplexing and varied it all was. Take labor ward as an example. I would be walking along the corridor and then the emergency buzzer would sound and everyone would be dashing into one room. And then the buzzer would sound again and everyone would be rushing into a different room. And after getting my steps in during the morning, I'd spend the whole afternoon scrubbed in theatre, watching surgeons operate and praying they won't ask me any anatomy questions. The next day, I'm in the clinic seeing pregnant people during their routine appointments, and in the afternoon, I'm in the emergency room asking if I can take a history from someone who's in pain. It felt like there was always something to see and do, and every day was different with different cases and scenarios. And I'd be lying if I didn't say that the bouncy balls on labor ward aren't themselves a good enough reason to pick this specialty. However, looking back, there were times during my placement I wish I could have done things differently to make the whole experience even more enjoyable. Because it is hard when there's limited time to learn what you need and also get your logbook signed off. So here are my advice for students entering the Obs and Gynae rotation. Advice 1. Ask and you shall receive. When I reflect on my placement, there were plenty of times when I didn't know something, but I didn't feel like I should bother the doctor I was shadowing. Maybe because they seemed busy, or maybe because I didn't want anyone to know that I wasn't a very bright medical student. Medical students are on these attachments so they can learn, so not asking questions is kinda dumb.
Not a great plan.
And what's the worst that could happen if I piped up? They'll either say I'm busy, or go look this up in the book. Even if I was quizzed, it's probably better to not know the answers then instead of during the finals, or if I'm having to manage the problem as a doctor. Of course, there will be times when one should refrain from asking, like when the team's dealing with an emergency. And asking isn't only limited to medical questions, but can be broadened into more practical stuff. Like, how can I get this competency signed off? Where's the best place to practice abdominal palpation? And how do I gown out for theatre? We've all gone through medical school. We all know what it's like to know very little.
Sí, un poquito más o menos.
So we're more than happy to help. Just ask. Advice 2. Only attend what is required. As there's only limited time for you to learn during your attachment, it's vital that you optimize your schedule. There will be some sessions which are incredibly useful, basically the ones you have with me.
I am awesome!
And there'll be others which aren't as useful. Back when I was a medical student, I would literally spend all my time in the hospital, even when there wasn't much going on. And I could have used that time more productively. But I thought if I attended everything, then I would become a great medical student / doctor. In truth, no one really cares, and it's far better if you're careful with how you spend your time. I know, some medical schools will keep an attendance record, or there might be a log of the different clinical sessions you're expected to attend. In that case, attend them once and reflect on what you've gotten out of them. And if they've been fruitful, ask if you can go to them again. The junior doctors are often good with recommending which sessions to attend. And there may be interesting sessions which you don't even know about, so ask the junior doctors or your tutor and they'll guide you to where you wish to be. Advice number 3. If you're planning to attend a session, be on time.
You're 3 minutes early. In Chicago.
There'll be clinical sessions of which the team you're attached to will be moving from one end of the hospital to another. But if you weren't there on time, you're going to miss out. And you won't be giving anyone a good first impression. Don't expect every session to start at the same time. Some may start earlier than others. Ask if you're unsure. Advice 4. If you're in the hospital, be prepared to learn. Studying and then practicing medicine should be treated both as a privilege and a responsibility.
Remember, with great power comes great responsibility.
Think about it. You're clearly smart enough to go through the academic rigors that led you becoming a medical student. You're probably at the top 1% when it comes to intelligence. A privilege. It's also a responsibility. I'm sure you wouldn't want a doctor who doesn't know what they're doing to be treating you or your loved ones. And so, if you decide to turn up, be ready to learn. That means freshening up on anatomy before theatre and read up on diabetes before the antenatal clinic. What you then see during these sessions will be more productive when you actually have some knowledge with what's actually going on. If you're going to be on labor ward, get in 10 minutes early so you can change into scrubs. And don't be a quiet observer. Ask yourself, what can you do to make this a more productive, ergo enjoyable session? If it's a clinic, can you take a history or examine a patient? If it's an on-call shift, ask if you can take blood or put in a cannula under supervision. Be proactive. Not only will the team be impressed, they're probably likely to teach and support your training. Also, if you're in the operating theatre and you start feeling faint, please let us know. None of us are good at assessing head injuries.
My head hurts.
Get used to it.
Number 5. Don't be abused. There's a difference between being asked to do something that is helpful for your learning versus being asked to do it because the doctor you're attached to is being lazy. If you're asked to do something that you're uncomfortable with, like putting in a catheter or closing the last layer in surgery without supervision, say no. It will probably feel uncomfortable at that moment, but it will protect patients and it will protect you if something was to happen, which will feel 100 times worse. Of course, there will be times when the team's extremely busy and you want to be helpful, which is great, but never do something you're not yet trained for. That also includes non-clinical work like research or audits. Before agreeing to them, think and ask, what are you going to get out of them? Will you be listed as an author? Will you be able to present the findings in a conference? Always check. How involved do you have to be before agreeing to it? Of course, having publications and presenting can be helpful for your career, but are you able to juggle this with learning the curriculum, as well as other things happening in your life outside of medicine? Always prioritize. If you feel bullied, intimidated, or undermined by a staff member, speak to your supervisor in the hospital. If that isn't an option, or if you're uncomfortable approaching your supervisor, there will be formal and informal paths in the medical school to notify such events. Never suffer on your own, and such behaviors and actions should not be tolerated in a hospital. 6. Be kind to patients and staff. Again, learning medicine is both a privilege and a responsibility, and if you're on an obs and gynae placement, this becomes an even more pertinent point. You'll have opportunities to be involved in very intimate moments in people's lives, especially when you're present for a birth. And so, if you have permission, say thank you. Show your appreciation. It can make a lasting positive impression to what is a very stressful situation. Be mindful that not all cases will be positive. There will be miscarriages or discussions of difficult news like cancer. Consider what can you do to be empathetic and caring. Equally as important, it's not just doctors who provide care. We're always working with midwives, nurses, healthcare assistants, support workers, and so on. Don't only be nice to them, but inquire what they do. Understand their roles and see if there's anything you can do to help when they're running about. A random act of kindness can go a long way. And who knows, the more involved you are, the more you'll be treated as part of the team. And that may lead to more opportunities. I remember a few years ago there was a medical student from Germany on her elective, and on the last day of her attachment, she got me a sandwich. I can't believe I still remember this. Maybe there's a theme. I guess what I'm trying to say is one random act of kindness can go a long way. And also, I can be easily bribed with sandwiches or cakes. Finally, work as a team. I know medical school can sometimes feel like Mad Max, one in which you can't even trust your best friend.
Because you can't.
Why are we best friends?
And it feels like everyone's trying to push you down so they can get to the top. If I've only learned one thing in medical school, it would be this. Working in a team is 100 times better than working in solitude. The goal is to be the best doctor you can, and that usually means being a team player. Form a messaging group with other students in the same placement and spread useful information, like where are the changing rooms and lockers located, and which clinic is best to get whichever task signed off, when and where are the teaching sessions held, or which doctor is easily bribed with cakes. A pistachio cake with vanilla. Just putting it out there. When you work together as a team, it makes the journey more enjoyable. I hope this is helpful. And of course, a lot of what we've discussed is applicable to any rotation. Give this video a like, and if you ever see me, say hi. Share, subscribe, and I'll see you again soon.